Welcome to the Health Insurance Education Series. This is the Transitioning Health Insurance Benefits to Adulthood. This is going to be our last family webinar for the 2024 season. Last year we did them in the spring, and then this year we've done them in the spring. And so this is going to be our last one for 2024. We will likely be back in 2025 with some new topics, but we really appreciate you sticking along and being here with us tonight to learn a little bit more about health insurance. So the housekeeping, the information is going to be presented in English. We would have normally been able to have a Spanish interpretation, but for some reason the settings in Zoom are not working correctly tonight. So we will try to find another option to make sure that the language is accessible for the future to get this information out for anyone that is most comfortable hearing the information in Spanish. There are slides available in English and Spanish, though. So on the DSCC website, if you go to dscc.uic.edu, you can go to Browse Resources and then the Family Education Webinars, and the slides where you can find them there both in English and Spanish. They've already been translated, so you can at least maybe follow along if you wanted with the Spanish slides. We are recording the presentation, and the recording will be posted on the website in the next coming days when it kind of takes a little bit of time to get up there, but it'll be up there with all of the other recordings and other materials that you have seen from the webinars in the past. The chat is muted, so you're not able to put anything in the chat or unmute yourself, but we do have a Q&A that you can enter information into, so you'll see a Q&A button down at the bottom. But we just ask that you don't share any personal information because it is being recorded and there are other people listening in. If you are asking questions or talking at some later when we do the Q&A, we'll allow some people to unmute if they want to. Just try not to share any personal information because we want to make sure that your privacy is protected. All right, so my name is Brittany Provost. I'm the manager of benefits management and research at DSCC. We're kind of the insurance experts here. We work with the DSCC care coordination teams to help solve insurance problems. We do some training things like this to make sure that everybody feels comfortable with the insurance information. And I've got two others of our team, Yadi Ramirez-Beckiu and Amy Edwards, here with me tonight, and you will be hearing from them as well throughout the presentation. We're going to do just a very brief DSCC overview. I'm sure most of you are familiar with DSCC if you're here tonight, but in case you're not, just to make sure that everybody is aware of who we are. We're going to talk then about the bulk of the presentation, which is hopefully why you're here, about planning for insurance options as you or your child is transitioning to adulthood. So we'll talk about Medicaid, Medicare, and private insurance, and then we're going to kind of weave in a little bit about Social Security stuff as well. But in March, there was a whole presentation on Social Security that was recorded, so you can go back and watch that. We're not going to go super in depth in the Social Security part because we're going to leave the Social Security experts to that part. And we'll give some resources and hopefully have a little bit of time for questions. All right, our vision is that children and youth with special healthcare needs and their families will be at the center of a seamless support system that improves the quality of their lives. And our mission is that we partner with Illinois families and communities to help children and youth with special healthcare needs connect to services and resources, which is part of doing this kind of presentation tonight, to give you guys the information directly. All right, and I will turn it over to Amy.
Hey everyone, thanks for joining us tonight. Sorry again for the delay. So we're going to talk tonight about what is health insurance. And health insurance is a type of insurance in which an insurance company agrees to pay for some or all of your medical expenses. Health insurance may also be called medical insurance or healthcare insurance. The goal of health insurance is to protect someone from high medical costs. There are many types of health insurance plans, and each plan will work differently. With some plans, you may be required to pay a monthly premium or other out-of-pocket costs like copays or deductibles. A premium is the amount you pay for your health insurance each month, and if you get health insurance through an employer, they may pay part of this amount. This is usually a set amount that they designate, and then you pay the remaining portion each month throughout that year of coverage. Okay, so keeping insurance benefits as an adult is important, so it's good to plan ahead and be prepared. Planning for insurance benefits for adulthood is a key area to make sure you or your child can maintain health coverage and continue healthcare appointments. Some programs will change from a child to adulthood, and the criteria to qualify for those programs could also be different. from a child to an adulthood. So it works somewhat like Medicaid or Social Security benefits. You may have experience and know that the criteria changes when somebody either turns 18 with Social Security or 19 with Medicaid. Disability benefits are also determined differently, as I just shared, for an adult from a child. So you may have different coverage options available to you through an employer or public benefits. And knowing those options and maximizing the benefits available to you is very important in the long run. A good part of planning ahead and using insurance effectively is to understand those benefits. You or your child may need to learn more about the insurance options available, and teaching your child about how their insurance works and how they can use it will help them in the future. The key to using your health insurance effectively is to learn about the benefits your plan offers and how your plan works. So we have some recorded trainings on the DSCC website that go more in depth over these topics if you are interested. And it's a good idea to learn about how insurance works in general. This can help you compare your plan options and know what to expect for out-of-pocket costs. You should know the benefits of your plan, or at least where to go to find that information if you need it. And knowing what services your plan covers can help you make sure that you can get the services covered that you need. It's also important to know your insurance network. So this means only going to providers that have agreed to work with your insurance plan. Some plans may offer out-of-network benefits, but not all plans do. Using out-of-network providers can be very costly, so you want to consult with your insurance company ahead of time. It's important to follow the insurance rules. These are things like getting prior approvals when required. This also includes the part about in-network providers that we just talked about. So for example, an HMO does not have any out-of-network benefits. If you were to go to an out-of-network provider without an approval from your insurance company, you would have to pay for that full visit. And also, if you get a denial, you need to review it carefully, and you have the right to file an appeal if you disagree with your insurance company's decision. This is your right, and you can exercise this right whenever you need to. You don't have to take no as the final answer from your insurance plan. So far, we have shared that there are different types of health insurance plans and different ways to get insurance. One way you can get insurance is through a public or government program. So Medicaid, Medicaid managed care plans, and Medicare are all examples of public and government programs. There are also private insurance plans. A private insurance plan is commonly provided by an employer, but you can also purchase one through the federal marketplace or a private insurance broker. Private insurance can be purchased for an individual alone or for the individual and their family. Most private insurance plans require a monthly premium, and the amount of that premium will vary depending on the type of plan you have and if your employer helps cover the cost of that premium. TRICARE is health insurance for someone who is active in the United States military. And then a campus health plan is a type of health insurance plan for a college student that is offered by the college or university they are attending. The cost for this insurance is decided by the school, and not every school is going to offer this type of plan. Campus health plans are usually limited on what they will cover, and the total cost of the plan is typically added to the student's tuition bill. More than likely, there will be extra charges and out-of-pocket expenses with this plan. There are also benefit plans that will offer limited coverage for specific things like prescriptions, vision care, or dental needs. These plans may cover things like eyeglasses, dental checkups, etc. So limited benefit plans won't provide complete medical coverage that someone would need if they went to the hospital or doctor's office, though. Let's talk about staying on a parent's insurance plan. In 2009, the Illinois Young Adult Dependent Coverage Law was created. This law allows a young adult child to stay on their parents' private health insurance plan until they are 26 years old. On a side note, if a parent has military insurance like TRICARE, their adult child is allowed to remain on this plan until they are 30 years old. But if you have an adult child, they can remain on the parents' plan even if they have another insurance, they're married, if they start or leave school, if they have or adopt a child, if they live in or out of the home that you own, and even if they aren't claimed as a tax dependent by the parent. It is possible for an adult child to remain on the parent's plan after the age of 26, but this does vary by state. Illinois law allows an adult child to apply to stay on their parent's plan past the age of 26, but they must meet certain eligibility criteria. So these are things such as they must be an Illinois state resident and they cannot be married. If an adult child is active in the military or they are a veteran, they could also qualify to stay on their parents' plan after the age of 26. Another important thing to keep in mind is that most private insurance plans will allow for a disabled child to remain on their parents' plan after the age of 26. Your insurance company will most likely require some medical documentation and possibly a letter from your adult child's physician confirming that your child is disabled. Different insurances and employers have different criteria to stay on after age 26. So you're going to need to talk to your insurance plan or your employer plenty of time ahead of your child's 26th birthday to see what is required, because this won't be a quick process. All right, so All Kids Assist is Medicaid coverage for children in Illinois. All Kids Assist coverage ends the last day of the month when a child turns 19 years old. So here's an example. Let's say Megan is turning 19 on May 7th. Megan will have active All Kids coverage through the month of May, but her last day in All Kids Assist will be May 31st. If Megan's birthday was May 29th, her All Kids Assist coverage would still end on May 31st. There are a variety of adult Medicaid programs that a 19-year-old can be considered for. The Department of Human Services will help determine the best program for the young adults. We recommend that when someone is 1 to 2 months away from approaching their 19th birthday, they apply for adult Medicaid benefits. This will allow DHS enough time to review the application and then issue an approval or a denial. Medicaid is required to make a decision about an application within 45 days of receiving it. Once Medicaid has decided, a letter will be mailed to the applicant with the decision and information about their new case if the case was approved. So it's important to know that for an adopted youth through DCFS, most will keep DCF Medicaid through the age of 18, and then they have to apply for adult Medicaid benefits like we just discussed. However, for children with special healthcare needs that are in DCFS Medicaid, DCFS will often extend their coverage until they're 21. So that person wouldn't need to apply for adult Medicaid until about a month before their 21st birthday. You would need to contact DCFS or your adoption worker about this if you have any questions. Now we are going to talk about adult Medicaid programs. There are several types of adult Medicaid programs that DHS could consider when reviewing a Medicaid application for someone who is turning 19 or over the age of 19. Tonight, we are going to focus more on ACA Adult and AABD, as those are the two most common programs, and we will talk about those more in depth in just a bit. For the next few minutes, we're going to briefly talk about some of the other less common plans. So DCFS has a Medicaid program called Youth Care, and this is for current youth in care or former youth in care that were adopted. We just talked about this, but it's important to know that this is a plan that an adult could be on through 21 if they were adopted and have special health care needs. There's also a program that allows those who were not adopted and just aged out of DCFS to be on this coverage until the age of 26. The idea behind this is that DCFS was the guardian when that person became an adult, and like with private insurance, that person would be allowed to remain on that plan until they turn 26. There's also a program called HBWD, or It's called Health Benefits for Workers with Disabilities. And this is a Medicaid program that allows a person with a disability to return to work while still being able to maintain their full Medicaid benefits. This program is available for someone between the ages of 16 to 64, and they have a certain income criteria that they must meet. It's possible that there could be a monthly premium with this program, and that would be based on that individual's income. These are some other programs that an adult could be placed in. We're not going to go in depth on these programs tonight, but we do want to mention them in general. Family care offers medical coverage to a parent or relative caregiver who lives with their children ages 18 years or younger. The Moms and Babies is a program for pregnant women, and it provides Medicaid coverage throughout the pregnancy and up to 12 months after the baby is born. Someone can be eligible for this program regardless of their citizenship or immigration status. There's also a program called HBIA, and that stands for Health Benefits for Immigrant Adults. And this is coverage for immigrant adults between the ages of 41 to 64 years old. A person can qualify for this program if they are not eligible for other Medicaid programs due to their immigration status. So with this plan, there could be copays and cost sharing on some services, and there is a $250 copay per any hospital inpatient stay. So anytime someone on this plan was admitted into the hospital, they would have a $250 copay. Unfortunately, right now, the enrollment into this program is paused and they aren't accepting any new applications. And then there's also HBIS, which is Health Benefits for Immigrant Seniors. And this is coverage for immigrant seniors age 65 years and older who are also not eligible for Medicaid due to their immigration status. With this program, there are no premiums or copays, and this program offers coverage for things like doctor's visits, hospital care, lab tests, and more. Unfortunately, this program is also not accepting any new applications at this time. All right, so now we're going to spend some time talking about the most common type of adult Medicaid coverage, and that's ACA adult coverage. And this is Medicaid for adults between the ages of 19 to 64. In 2014, the Affordable Care Act provided states with the ability to expand Medicaid to adults that met the income limits. Before that, you would have had to be in another special eligibility category to qualify for Medicaid as an adult. To be eligible for ACA, you must meet the monthly family income limits, and the income limit is 138% of the federal poverty level. This is the same limit as family care, and there is no asset limit with this plan. I'm actually going to give you updated numbers than the ones on the slide. The ones on the slide are the 2023 numbers, but so for a family size of one, 138% of the federal poverty level is about $20,784 per year, or that would come out to about $1,732 per month in gross income. With this program, you must be a U.S. citizen or meet certain requirements for non-citizens. There are no copays, coinsurance, deductibles, or premiums for this program. Another common program that we see a lot at DSCC is AABD, and this is Aid to the Aged, Blind, and Disabled. And this is just another type of adult Medicaid program that offers coverage for individuals who are blind, individuals with disabilities, or are 65 years or older. You must be a U.S. citizen or meet certain requirements for non-citizens, and you must meet the family monthly income limits for this program. So with this program, the income limit is 100% of the federal poverty level. And this is the lowest income limit we have seen in the programs that we've discussed tonight. So remember, Medicaid will determine which program you qualify for. So they will only put someone in AABD if they don't qualify for another program that has a higher income limit. With this program, there is an asset limit, and that amount is $17,500 per person. And before 2023, the limit was actually $2,000. So this did significantly increase in the last year, which is a good thing. Assets are things like extra vehicles or extra homes. Someone is allowed to have one car and one home without it counting against them when applying for this program. But things like a savings account that has a balance in it, that would be considered an asset and could possibly count against you if it exceeded the asset limit. With AABD, there are no copays, coinsurance, deductibles, or premiums. All right, we're going to talk a little bit about completing a Medicaid application, and there are 4 ways to apply for Medicaid. You can apply online, over the phone, in person, or with a paper application. If you are able to apply online, we highly recommend this because it will provide you with a confirmation number once you submit the application, and you can use that for tracking your application. The person that is applying for adult Medicaid benefits needs to apply as the head of the household, which can be confusing if you have an adult child living at home. In a few moments, we're going to talk a little bit more about what to do if someone is unable to fill out their own Medicaid application. Aside from income information, the application will only contain information about the person who is applying for benefits. Information that they would need for their application would include their address, phone number, date of birth, social security number, citizenship status, and then they need to be prepared to answer questions about any disabilities, or if you're applying for SNAP benefits, they'll ask more specific questions about your income and how many people live in the household. One of the questions asked is if the applicant is going to be filing taxes on their own or if they're going to be claimed as a dependent on someone else's tax return. And this is where things get a little bit messy. If the person applying is claimed as a dependent on someone else's taxes, then the income from the other household members must be included on this application. So if the applicant parent's income makes them ineligible for Medicaid, but they do have SSI, which is Social Security income, their application will be processed as a disabled adult child. If the person applying for Medicaid benefits is not claimed as a dependent on someone else's taxes, then they only need to provide their own income information. You may need to consult with a tax specialist, like an accountant or a special type of attorney, if you have questions about whether you should claim your adult child on your taxes or not.
The only thing I want to add here, because I didn't say it before, is that we are not Medicaid, we are not DHS, we're not Social Security, we're not Medicare. Kind of a general disclaimer that, you know, all of the information that we're giving everyone tonight is just information based on our experience with these programs. We don't make decisions about these programs or about the applications or any, like, write the policies for them or any of that stuff. So I just wanted to kind of caution that, you know, this information coming from us is our experience, but if you have specific questions about Medicaid, about the application process, and any other things that we're going to talk about tonight, you should go to that entity. DSCC is always a great place to start. We will, you know, give you as much information as we have, but like Amy said, some of these situations get very tricky. And when that happens, we want to let DHS make the decision about what needs to happen, like what information they need, all that kind of stuff. Okay.
Yes, thank you, Brittany. We're going to talk a few moments about what to do if someone needs help with filling out their Medicaid application. If the person you are helping if they're able to make decisions on their own, and if they can physically sign their own name, then it may be appropriate to get a healthcare power of attorney form. And what this is it's a form that says someone has picked a specific person to be their healthcare representative. This needs to be a person that you trust to make decisions for you if you are unable to make those decisions yourself. You can print out a copy of this form online to fill out and sign. You will need to sign it in front of a witness, and that witness will also have to sign the form. You and your witness must be at least 18 years old and be able to make decisions on your own at the time of filling out the form. You would have to submit a copy of this form with the Medicaid application you helped complete. So keep in mind that the person you are assisting does need to be able to sign their own name on the Medicaid application and on the healthcare power of attorney form. If they are not able to do that, then this would not be an appropriate option for them. If the person that needs to apply for Medicaid does not have the ability to complete their own application or sign it, then you will need to consider a couple of other alternatives. One of those alternatives would be guardianship. And guardianship of an adult, which is someone who is 18 years or older, is when a judge has decided that an adult can't make basic life decisions and that they need someone to oversee their care and make the best possible decisions for them. There are different reasons that someone may need a guardian, and to become a guardian means you meet certain criteria. The process of becoming a guardian can take several months, and to start, you would need to find out what forms are needed to be completed for someone who is requesting guardianship of another person. These forms will vary by what county you file in, so we recommend that you call your local circuit clerk office and ask them what forms you will need. These forms will ask questions about a person's finances, personal property, any relatives, medical history, and more. After you fill out and submit these forms, you will be assigned a court date. You and the person you are seeking guardianship of will be required to attend a hearing where a judge is going to ask questions, review your application, and then they will make a final decision about whether they feel this person needs a guardian. It is possible that your court may charge a fee to hear your case, but you can request that the court consider waiving those fees. Of course, like Brittany shared, every case is different, so it may be a good idea to consult with an attorney about your desire to become someone's guardian before starting that process. If a person doesn't have a court-appointed guardian, but they do need someone to complete the Medicaid application for them, and they also do not have the ability to make that decision, you will need to speak with that person's physician about getting something called a certification for surrogate decision-making form. They need a better name for that. So this is when two doctors will assess and certify that a person is unable to make healthcare decisions for themselves, and they need someone to advocate and make decisions for them. A family member or friend must initiate the process with the physician. The physician will want to meet with the patient, and it will be up to the physician as to whether they feel this is an appropriate need for their patient. So this certificate would allow you to complete and sign off on a Medicaid application for your adult child. You would need to submit a copy of the certificate with the application for DHS and HFS to have on file, and this would allow for you to serve as an approved representative on your adult child's Medicaid case. We've included the links to these forms on this slide, and you will be getting the actual slides to this within the next few days. So we're going to talk about what an approved representative is, and DHS considers an approved representative to be someone you choose to act on your behalf when it comes to your medical benefits. A personal representative is another name for an approved representative. So in this role, someone may assist another person with their Medicaid application, their redetermination notices, or other communications. They may also call and speak with someone at DHS or HFS if there are questions or issues with your case or Medicaid coverage. To appoint an approved or personal representative, an individual must be able to choose someone that they trust to serve in this role, and then they must be able to sign a form for DHS and HFS giving their permission. You can appoint someone at any time to serve as your approved representative, and you can also withdraw your permission if you need to. We have included the links to those forms in this slideshow, which you will receive in the next few days, but please keep in mind that DHS and HFS are separate agencies, so you will need to sign a form with each one of those agencies. DHS calls this person an approved representative, and HFS calls them a personal representative. All right, so we are going to talk about redetermination really quickly. And each year, Medicaid will review your case to make sure that each member still qualifies for the Medicaid program. These reviews were not completed from March 2020 through June 2023 due to the public health emergency for COVID-19. If you are unsure if you have gone through redetermination yet, you can reach out to your local DHS office, or you can go online at abe.illinois.gov to see when you are scheduled for. This is a very important process, and you want to make sure you complete this because this could prevent you or someone on your case from losing their Medicaid coverage. It's important to make sure that DHS and HFS have your correct address and phone number on file in case they need to reach you. Not everyone will go through redetermination at the same time. So for example, your redetermination could be in March, and you could have a friend who goes through redetermination in October. So you should always check your mail and pay attention to any letters that you receive from Medicaid. So with redetermination, Medicaid's going to check your residency, income, and other requirements just to make sure that you still qualify for the Medicaid program that you're in. The transition from All Kids Assist into adult Medicaid could come with a few changes. Overall, the adult Medicaid program provides similar coverage and benefits as All Kids Assist does, but adult Medicaid may require that you get special permission for things like certain services and prescriptions. And this is what we would call a prior authorization or prior approval. When someone turns 19, a prior approval is required if they have more than 4 prescription medications. And then at the age of 21, some coverage changes could come into effect for benefits like dental care. Overall, the changes with the adult Medicaid program should be minimal. And if you have questions about that, we would recommend you reach out to your DHS office to ask them about that. Or you could also visit the DHS or HFS website. Now Yadi is going to take over and talk about Social Security benefits.
Thank you, Amy. Now let's talk about supplemental security income and the Social Security disability insurance as it relates to Medicare coverage. There was a recently recorded presentation on this topic in March, so we will not go into details about them tonight. However, you can find the recording in our DSCC website. So I will just highlight the most important points of the SSI program. SSI is a federal program administered by the Social Security Administration for people ages 65 and older, as well as for people of any age, including children, blind, or disabled. It provides monthly payments to people who have low income and few resources. It is important to know that this program does not offer a medical coverage. SSI is based on financial needs, and being eligible for SSI does not mean that you automatically qualify for Medicaid in the state of Illinois. This may be true in other states, but in the state of Illinois, you must also go through the Medicaid application process. To qualify for Supplemental Security Income, SSI, you must have physical or mental condition that severely limits your activity, and you must also be considered a disabled person by the Social Security Administration. You must be a U.S. citizen or meet the non-citizen requirements. You must be a resident of the U.S. or U.S. territory. You must apply for any other benefits you could qualify for, including Medicaid and SNAP. You need to have limited income. SSI program considers income as anything a person receives that can be used for food or shelter. The resources include cash, bank accounts, stocks, mutual funds, U.S. savings bonds, land, life insurance, over 1,500, personal property and vehicle, etc. You're allowed to have any vehicle, one vehicle in one home, which will not be deducted. The participant must not be working, or if you're working, but not engaging in substantial gainful activity. And you may ask yourself, what is substantially gainful activity? It is the work that involves performing significant, productive, physical or mental tasks and is performed for the purpose of obtaining payment or benefits. To be redetermined for SSI, you must need to meet two main things. One, to prove that you still qualify for financial assistance through SSI. And second, to make sure your monthly payment amount is appropriate for your financial situation. During the SSI redetermination, Social Security review your income. To receive SSI benefits, your countable income cannot exceed the maximum federal benefit payment for the program. The countable income is any item an individual receives in cash or in kind that can be used to meet his or her needs for food or shelter. The resources are the assets you own, such as cash, property, excluding the primary residence, life insurance, the vehicles, and anything else that can be converted to cash and used for food or housing. The SSI countable resources limit for 2023 is 2,000 for an individual and 3,000 for a couple. If the countable resource exceeds, you will not be able to qualify. The living arrangement is another factor that helps determine how much you will receive in SSI benefits each month. Live in the same place when you started the application. If your current resident had changed, then in some cases, the monthly payment may be reduced. This might happen if the participant now lives in another person's residence and pay minimum food or housing costs, or if the participant moves into a nursing facility where Medicaid covers more than half of his or her costs. The Social Security gives 12 months to process the redetermination. Someone under the age of 18 who was considered disabled as a child but may not be able to qualify as an adult. SSI uses two different criteria, one for children and one for adults. For children, you could combine disability impairments to qualify. But for an adult, it is stricter, and you must qualify based on adults' impairment evaluation. The Social Security Disability Insurance, or SSDI, it is a program that provides income supplements to people who are no longer able to work because of a significant disability. It is important to understand the difference between SSI and SSDI. They are two very different programs. SSI pay benefits based on financial needs, and SSDI pays benefit if someone is insured or entitled to the benefit. This means that you have worked long enough and pay Social Security taxes. Insured status means that a parent is either deemed disabled, receiving SSDI, or receiving Social Security retirement benefits, or is deceased, or either fully insured or currently insured. Getting SSDI benefits does not mean that you qualify for Medicaid. You will have to apply for Medicaid to see if you could qualify. To receive benefits under the SSDI program, you must meet the SSI definition for disability. You must have a physical or mental condition that severely limits your activity, and you must also be considered a disabled person by the Social Security Administration. That means that you cannot do work at a substantial gainful level because your medical condition. You cannot do work that you previously did or adjust to another work because of your medical condition. Your condition has lasted or is expected to last 1 year or to result in death. You must be a U.S. citizen or meet the non-citizen requirements and be a resident of U.S. or U.S. territory. You must also have the insured status, which is done by earning work credits through your work history. By earning credits, when you work and paying Social Security taxes, to qualify, you must have 40 work credits, which is equivalent to 10 years of work. You can draw off either your own or your parents' work record or status. A parent must be deemed disabled, receiving SSDI, be receiving Social Security retirement benefits, or is deceased and either fully insured or currently insured based on their work history. Disabled young adult that qualify for SSDI is drawing off their parents' record or status. Remember, you must be deemed disabled by Social Security as having medical disability and meet their adult disability criteria. Okay, now let's talk about Medicare. Medicare can be really, really complicated. So we are just going to spend a little bit of time on it tonight. Medicare is easy to be mixed up with Medicaid. The name sounds familiar, but they are very different programs. Medicare is a federal program. This means that it's run by the United States government. Medicare is not really a program you apply for. You become eligible when you are eligible for it or qualify for it. To be qualified for Medicare, you must be, again, a U.S. citizen or a legal permanent resident. If you are a legal permanent resident, you may have some limits with your Medicare. We generally think that Medicare is for people over 65, and that is a large group that can qualify for it. There are also other adults or children under the age of 65 that can qualify for it. A disabled young adult can qualify for Medicare if they have certain disability. The disabilities that are eligible are set by the Social Security Administration. A disabled young adult must get Social Security Disability Insurance, or SSDI, for 24 months before they will get the Medicare get into the Medicare program. Others at any age could get Medicare if they have end-stage renal disease, kidney disease, or ALS, known as Lou Gehrig's disease. If you want to know more about the disabilities that qualify, you can go to the Social Security website. We have put the link. You can look at after you get the slides. You can contact the Medicare or the Social Security Administration if you have questions about it. You may qualify, or your child may qualify for Medicare. Now we're going to talk about the age group of disabled young adults and how they are getting Medicare. It is important to remember that Medicare is not a program that you apply for. You must receive SSDI for 24 months before being eligible for Medicare. If you don't qualify for SSDI yet, then you cannot qualify for Medicare this way. You can still qualify for other reasons like end-stage renal disease. Again, to receive SSDI, you must be a disabled young adult or drawing of their parents' work history or parent status. Once someone receives SSDI for 24 months, on the 25th month, they will send a Medicare card and automatically be enrolled in Medicare. Since Medicare is not something you apply for, you can contact the Social Security to see if or when you or your child might qualify for Medicare. Now let's talk about Medicare coverage. Medicare is a comprehensive medical coverage. The coverage is divided into different parts. Part A is for hospital coverage, and this covers things like skilled nursing facility care, inpatient care, and hospital, hospice care, and some home health care. Under Part B is for medical, or what we think of outpatient care, such as doctor services, inpatient care, durable medical supplies, preventive services. Under Part C, this is the Medicare Advantage plans, covers all the services in Part A and B, and usually includes Part D as part of the plan. It is run by private insurance companies that follow rules set by Medicare. This may include extra benefits and services that aren't covered by original Medicare, sometimes for an extra cost. Part D is the medication benefit, and it helps cover the cost of prescription drugs, and it is run by the drug plan, such as Humana. These plans vary slightly, so you will want to work with your pharmacy to choose the best plan. When you become enrolled in Medicare, then Medicaid can no longer pay for your medications. So choosing the best Part D plan is essential for Medicare coverage to work for you and your needs. What is not covered by Medicare? Under Part A and B, they do not cover most dental care, denture, eye exam, for glasses, cosmetic surgery, acupuncture, and hearing aid. It is important to know that if the participant has Medicaid, some of these services like dental care and hearing aids are covered by Medicaid. Medicare Advantage plans, they might also cover some of these services as their added or extra benefits. You can visit the Medicare website to check coverage of specific services or items. You can also call the Medicare. Help with Medicare costs. On the Part A, most recipients do not have to pay a premium for this, but some may have to pay a small premium. On the Part B, it is an optional plan. It is important to know that if you have Medicare coverage available to you and don't take it, then Medicaid may refuse to pay. So it is technically optional, but if the participants do not opt into these different parts of the coverage, they could be without coverage. The premiums usually come directly out of the participant SSDI payments, so pay attention. You may not realize you are paying these premiums. If you have other coverage, like private plan, you can opt out of this. You need to tell Medicare that you have other insurance that is comprehensive through. If you don't take Part B, when it is offered to you, and if you don't tell them that you have other insurance, you will be penalized for each month that you didn't pay or that you didn't take it. That can make your premium for this plan very expensive. On the Part C, these are optional plans and will have a higher premium. On the Part D, this is also optional as well. But remember, Medicaid cannot pay for medication when someone is enrolled in Medicare. So you should opt into this plan if you need Medicare to keep covering your medication. There are Medicare savings programs that can help with this premium cost, Part A and B. They are based on different income levels, and that will determine what the state will cover for you. To apply, you could make an application through the DHS online or at a.illinois.gov. You will also choose the Medicaid Saving Program as the application type. You can call the DHS helpline and call the Illinois Department of Aging if need. They can also go in person to the local DHS office. The Extra Help is a Social Security Administration program that helps with out-of-pocket costs for Medicaid Part D to someone with limited resources and income. It helps with monthly premiums, annual deductible, prescription co-payments. We have been told if someone has Medicaid and become eligible for Medicare, they should automatically be enrolled. To apply for this program, these individuals should contact the Social Security Administration. As you see in this Medicare fact sheet, the DSCC has available on our website. It will be uploaded with the resources for tonight's presentation. It explains a lot different things about Medicare that we just talked about, so you can review this. You can also get your insurance privately. One way is through a job or employer. You can get the private insurance if your job offers it to you. to your spouse or if you are on your parents' insurance. A child can stay on their parents' insurance through age 26, regardless of the child's is married or has other insurance available to them. Not all jobs have to offer private insurance, but many of them do. If you get insurance through a job, you might also have one plan option or you may have many to choose from. Keep in mind that usually you can get only sign up for insurance plan or make changes to your plan during the open enrollment periods. This is a specific time of the year when employer allows you to make any changes. It can be at every employer. You can also make changes if you have a special life event like getting married or the birth of a child or adopting a child. You should talk to your employer about when you can make changes to your health coverage. Another way you could get the private insurance is through the federal marketplace. This is a website where you can buy health insurance. Like private insurance through a job, you can also sign up for insurance during a set open enrollment period, which happens once per year. It usually happens at the same time each year around November and December. Otherwise, the only other time you could enroll is if you have a special enrollment period. It is important to note that if you are offering insurance another way, like through your job, you may not be eligible to get a plan this way. Having another health coverage options will also affect your eligibility for cost savings on marketplace premiums. So it may cost you more to get the plan on the marketplace if for some reason you choose not to take your health insurance through your job when it was offered to you. You can go to the Illinois website, getcoveredillinois.gov, or you could go to the healthcare.gov. There are many plans options to choose from each year. Remember, we are not the special enrollment period, so you will need a reason to have a special open enrollment period to be able to choose a plan. Remember, you cannot be excluded from coverage due to a pre-existing condition. Some plans are grandfathered in, but any new plan cannot deny you due to a pre-existing condition. This plan comparison chart will help you understand how plans work and what the important parts of them are. You can see across the top are all the different plan types and their names. You can then see if they require a primary care physician to manage your care. Plans that require a primary care plan also usually require you to have a referral from your primary care doctor to get the care. They like to know that someone is monitoring the care that you are getting. You can also see if the out-of-pocket network coverage is common under that plan. You can see how much the cost might vary. This is just an estimate. The actual charges will vary based on the plans you have available to you. You can also see the size and type of provider network that have access to with that type of plan. Finally, this is a summary at the end of the important parts of the plan. This is just meant to be a helpful guide. So you should talk to your employer benefits office or human resources department for more information on your plans. If you're getting your plan through the federal marketplace, there are also a sister that can help you to understand the plan options. The college or university insurance, students can purchase insurance benefits from their university, and eligibility might be based on student status, whether they are part-time or full-time student. Consult with the university health service or the college admission office to discuss the health insurance options they offer. You might also need to check with your current medical providers, whether it's your doctor, the therapist, medical supplier, to see if they are in the university plans network. Some universities plans may not offer coverage while the classes are not in session. So for example, when they are in a summer or winter vacation, and with this, I will let my coworker take it from here.
All right. Thank you, Yadi. And we are wrapping up things now. So just want to share some resource links. So these are some different resources. Some of them were kind of weaved throughout the presentation as well. But if you have already looked at a copy of the slides, at the very end on this slide, you'll be able to click around on those links, and it has some helpful things that will aid you in the process as you're starting to plan or understand a little bit more about, the transition process for health insurance benefits. So just some kind of key takeaways from the presentation. It's important to start early and plan if you can. If you're not ahead of the game yet, at least, you're here tonight. That's an important part, right? You're here, you're getting the information. That's really an important step to being able to transition health insurance benefits to adulthood and make sure that they're the right benefits. Some benefits or programs may change from a child to adult. Amy kind of talked a little bit about that, and Yadi did too, with some of the different programs like Medicaid, Social Security, Medicare, and kind of how that eligibility changes over time. So just being aware of all the different insurance options and what might be the best fit for you or your child is a great place to start. So now we would go into questions. I'm going to skip this for right now. If you do have questions and you want to stay on with us, that's great. I will circle back to this in just a moment. But since we're way over time, just because of the delays at the start, I want to kind of wrap up the presentation and then we'll go back to questions. So if you've stuck with us this long, thank you so much for participating in our training. We really hope that you found it helpful, that you at least were able to take something away from it. You will get the email link to the website. Zoom will send a link out, I think tomorrow, sometimes about like 24 hours after the presentation, where it'll have this link for the DSCC website. But again, you could go to the DSCC website, go to Browse Resources at the top in that menu, and then click the Family Education Webinars to get all of the recordings. So all the materials for any of the webinars we've done are there. The ones we did last year, the ones we did in March and April, and then this one will be posted there. So anything you need will all be there. There'll be a survey that'll pop up at the end of your screen when you kind of close out Zoom. If you take a few minutes to complete that, we really appreciate it. We want to know any other topics that you want training on. Like I said, this is our last kind of session for 2024. So we're looking to plan 2025 and future ones. And we always want to make sure that the information that we're training on is information that's most relevant and most helpful for you. So there's no future webinars right now. Again, watch your email. You'll get emails if you're subscribed to DSCC emails about the future ones that are coming out. But in March, we did Social Security benefits. In April, we talked about Medicaid denials. And then tonight, you're here for the transitioning health insurance benefits. So again, if you want to review any of that stuff, head to the website and it'll all be there. And then this is the phone number. And then you could just use the general DSCC email. If you have questions, if you're not able to stick around and ask your question, if you want to go to dscc@uic.edu and just send an email, if they can get it to us, and we could schedule a time to set up a call with you and kind of talk through your specific situation. Like I said at the beginning, I don't want anyone to share private information when we're doing question time. So if you have a question that's really involved or a situation where you kind of want to be able to talk through you and your child's unique situation, then I think, definitely feel free to reach out and we can get a call set up and kind of talk through what's going on. And your DSCC care coordinator, if you're linked up with DSCC, is a really great place to start as well. So I'm going to stop sharing and then go look and see if there's anything in the Q&A because I cannot see it right now. All right. Looks like there's a couple of things in the Q&A. Okay. So it says, does someone who qualifies for Medicare and has Medicaid as a secondary coverage need a supplemental policy when they are on many medications or have very complex medical issues? That's I guess a personal question, honestly, for you if you feel like you need additional coverage. I think that Medicare and Medicaid together are fairly comprehensive coverage. So I think if that's something that, you know, you're on or a family member is on and it's working for you, then there's perhaps, you know, not a reason to be on additional coverage. But if you're concerned that something's not being covered, definitely feel free to reach out to us and we can kind of talk through what that is and kind of maybe where that might be covered, because Yadi was kind of explaining Medicare can be a little bit tricky, particularly when it comes to medications. They don't really want to cover medications the same way that Medicaid could, and Medicaid can't cover medications if Medicare is involved. So it gets pretty complicated. So in that situation, I mean, a prescription policy, you know, may be helpful, but I'd hate to, you know, lead you into purchasing more insurance if you don't need it. So that may be something best to kind of talk through together in a more specific way. And then the second one was, do we have information about spend down? And to be honest, we could probably have an entire webinar about spend down. So spend down is a Medicaid program that essentially is when you're over income for Medicaid, okay? So if you don't fall into the income limits that we kind of briefly touched on for All Kids Assist or AABD or ACA Adult Medicaid, it can make you over income, and then what will happen is DHS will try to consider you for a spend down. And a spend down, the easiest way to explain a spend down is that it's like an insurance deductible, right? That you have to pay some of your health expenses before Medicaid would kick in and start paying expenses. So it can get very complicated. We do have a handout on the website that goes up over spend down. So if you just go to the DSCC website, or honestly, if you just Googled DSCC spend down, all is one word, I think, perhaps try both ways. I don't know which way it's going to come up. There are two handouts that'll come up, one in English and one in Spanish, about spend down and how spend down works. And again, I will offer this is you're in a situation where you think you're going to qualify for spend down, your child's on spend down, and you want to kind of talk through what it is and how it works. Definitely feel free to reach out. I kind of like to tell our staff here that I don't encourage them to really remember specific details about spend down because it can get very complicated and it doesn't often come up. So it's hard to kind of remember all the details. It's only like when you're in it that you need to really remember all the specifics about it. And then someone asked if parents' income counts towards having Medicaid when their children are 18 or older in school and are full-time students. So it can kind of depend on the situation, but generally speaking, for an 18-year-old child, parents' income is going to count. And if that child is living on their own, not being claimed on taxes, is emancipated, is like an unaccompanied minor, those are some like legal terms. But if they're in a situation where, you know, you're not claiming them on taxes, there's a chance that they could qualify for their own separate Medicaid case. But in, I'd say 99% of the situations that we see, an 18-year-old child is going to be on the family case. They're going to be getting All Kids Assist, and parents' income will be counted. And it looks like Amy threw up some the handouts for those questions. So if you're the ones that answered those questions, you'll be able to see the links. But if you are not the ones that answered the question, you probably won't be able to see it. But we can include the spend down handout link with the presentation materials too. We'll make sure it gets uploaded tomorrow. But otherwise, there's lots of materials with the presentation already uploaded. Okay. And there's one more question. It says, what is the SSI family resource limit? Yadi, did you have that handy with you right now for the SSI resource limit? If we don't have it handy, I may have to defer that question, but I can take down your information and get it to you after we are able to look it up. All right, and that is all the questions that we have in the Q&A right now. Again, feel free to reach out to us if you have specific questions that you want to talk through at a later date. You can just use that general DSCC email, or if you want to get in touch with your care coordinator, we can certainly get in touch with them too and kind of schedule a call with you. But thank you all so much for sticking along this far with us. We really appreciate it, and we hope that you have a great night.